So now we shall be discussing the first infection in the herpes group, that would be herpetic gingivostomatitis. Okay, we shall be discussing about herpetic gingivostomatitis. So we shall be discussing only the important points because in detail lecture is already recorded on herpetic gingivostomatitis, right? Regarding this herpetic gingivostomatitis, the first important thing you need to know is that this is the most common infection for which virus? Herpes simplex virus type 1. So this is a most common infection of herpes simplex virus type 1. This is the most common infection. Which age group is most commonly affected? Children of age 1 to 3 years. So most common age group will be children of age 1 to 3 years. Children of age 1 to 3 years. So what are the important things you would find in this patient? So first important thing is that you would see fever, right? Apart from fever, you would also see lymphadenopathy. Apart from fever, you would also see lymphadenopathy. You will also see vesiculo-ulcerative lesions, right? You would also see vesiculo-ulcerative lesions, right? So these are the lesions which are associated with vesicles. So they have got vesicles, right? When you break down the vesicle, there will be fluid, clear fluid that will be released out of this vesicle. Okay. Next important thing is that this herpetic gingivostomatitis, whatever is there, this is called as a primary infection. Okay. This is not called as a relapsing infection. It is called as a primary infection. So this herpetic gingivostomatitis is nothing but called as the primary infection. This is nothing but called as a primary infection, right? And another important thing is that where will this virus HSV-1 resides in your body? So this virus mainly resides in the trigeminal ganglia. Okay, so this mainly resides, herpes simplex virus, mainly it resides where? It resides in the trigeminal ganglia. You know trigeminal ganglia, how it is formed, guys? It is formed by the union of three nerves, right? So ophthalmic, maxillary as well as mandibular, that is a fifth pair of cranial nerve. So all of them join together to form a ganglion that is called as trigeminal ganglion. So within the trigeminal ganglion, you would see HSV-1 residing. Okay, so resides in the trigeminal ganglia. Now what will happen? What will happen is that it won't cause anything, but it won't disturb you. But if the patient is having recurrent infections, right? If the patient is having recurrent herpes infections, what will happen is that this HSV-1 which was sleeping in the trigeminal ganglion will reactivate. Okay, so it would reactivate. So it would reactivate and cause a disease called as oral labial herpes. Oral labial herpes. Oral labial herpes, or also called as herpetic fever blisters, or also called as herpetic fever blisters, or what is another name for this? Or cold sores. You call it as cold sores. Okay, so overall in this topic you need to remember two important things, that is, if HSV-1 infection, okay, here also HSV-1 infection. Now if HSV-1 infection, the primary infection, whenever the patient is first time exposed to this HSV, that is called as a primary infection. So in primary infection, the patient will not get cold sores, but the patient will get gingivostomatitis. The patient would get what? Gingivostomatitis. But if there is a reactivation of this, If there is reactivation of this, then patient will not get gingivostomatitis, but patient will get this oral labial herpes. Oral labial herpes. So you need to be super clear about what is primary infection, what is reactivation. Okay, so in primary infection there would be gingivostomatitis, whereas in reactivation there will be oral labial herpes or cold sores. So this is all the important thing which you need to know regarding the herpetic gingivostomatitis. Thank you so much for watching my video. Goodbye.